Hi, everyone. Thank you for planning to be here with us today. We will be presenting the results of our project that we did last year. It was a community project entitled Examining the Unmet Needs of British Columbians Living with Myalgic Encephalomyelitis, a mapping of a provincial needs assessment. So our sponsors and partners are listed below on the screen. This project was a partnership between the research team at the MEFM Society of BC, staff at the Women's Health Research Institute at BC Women's Hospital, and funding from the Vancouver Foundation was key. So let's first discuss a bit of the background of this project. Moving from the left to the right on your screen, this project was designed to consider the unmet needs of BC folks living with ME. This was a pilot project, and it was aimed to test some mechanisms of data collection, of reaching out to stakeholder groups, and to begin to potentially prepare for a larger province-wide needs assessment. But we also aimed to start exploring ME care in BC and starting to understand the needs of patients here. Before we detail more into the methods, the most remarkable thing that we first had to address was COVID. We were about to start this project right when the pandemic started. Were we able to go ahead? How would we have to adjust our plan? So what we did was initially we had funding to have a lot more in-person contact. So we adjusted having in-person data to virtual data. We also had planned to have a larger group come together in Vancouver, a mix of patients and clinicians and stakeholders. And instead of that, we held 4 virtual focus groups with patients, and we rolled out an electronic survey to BC clinicians. So for a pilot project level effort, we were very pleased to be able to speak with 25 patients in BC, and we had 173 clinicians participate in our survey, all of which happened at the onset of a pandemic. Another aspect of success in our methods is that we had a wide range of representation. In our patient groups, we had patients from each health region, urban and rural, and we had about 25% male, and we had a range of ages. In our clinician survey, we also had a range of professions, and they were also representing across the province. So for a pilot, this was a great success. And while this was a community-based project, we conducted it as close to a full research project as we could. So there was consent, there was methods and analysis that was typical of both quantitative and qualitative data collection and analysis. Another important design feature was that this was considered a patient-led patient research project. So Hillary and I both were responsible for all of the data collection and analysis, and we both have research backgrounds as well as being attached to the ME patient community. So by sharing this project with you today, I hope that you gain some insights into what it is like for the patient experience in BC, what living and navigating care in ME is like as well. So these are what we consider the 2 hallmark quotes from the project. If we had to sum up this project and this work in 2 sentences, this is it. ME took away every single thing, every construct I was as a human being. I feel extremely sorry for them because BC has almost nothing for them. So now I'm going to move into some more specifics of the patient material we collected. There were 4 key themes that surfaced from the data that we gathered from patients. Social isolation, loss of identity, and emotional support was one. The supports for disease management and how to live with ME was the second theme. Challenges to diagnosis and stigma in the healthcare system was the 4th. So now I'm going to go through each of these 4 using a series of graphics that we had done as part of the project. So the next slide is quite visually busy, so take your time to adjust. We will stay on this for a while. So here's an example of the graphics that we had developed. So we took the data and then we worked with an illustrator to be able to create this. This is on social isolation. So you can see here that within this theme, the patients highlighted both a profound isolation with grief, loss, yearning, and an impact on life overall. ME patients are very ill, and profound isolation is expressed in this disease experience. Many that we spoke with were unwell to work, furthering the loss of professional social interaction. There was a loss of adult connection and relationships with spouses, loss of parenting capacity and interaction with children. Participants also described that they would need to rest from their family or the activity of the home by being in other rooms. Patients without an immediate partner or family support within their home described even further profound social isolation. Another aspect that furthered the isolation was the description of experiences that patients said they felt alone in seeking out information and finding care. But we also heard a consistent willingness and a very strong resilience in those that we spoke to. The conversations about social isolation and loss of identity led many patients to discuss their emotional health support needs. So patients started suggesting to us having ME accessible support in place to help with emotional wellness and to support connection. Overall, there was a strong note that there's a distinction between mental illness and mental wellness within the disease community. Sadness versus depression were important distinctions in the ME journey, noting that sadness and grief are part of the experience. In this quote, a patient described their illness experience as this: "It's impacted my life in every aspect of it, from who I feel I should be, to my career, right down to my relationships with my friends and family and strangers. Yeah, I don't think that there has been one part of my life it hasn't touched or changed in some way and forced me to rethink or reevaluate. And I know if I didn't have it, that I would be a very different person than the person I am." The next theme is about patient support and patients' navigation in seeking care. Looking on the left, you'll see that support for ME patients was varied. A big distinction was whether a patient lived alone or not. For those with a partner or family member, the patient was supported in their daily living, often solely by another individual. That includes food shopping, preparation, yard work, housework, parenting, and even financial support. Patients living alone seemed so focused on, quote, just existing or, quote, surviving day to day. Some of these patients described attempts at having community-based support into their homes, like home care services. However, these services were either an ill fit or the lack of ME education and awareness by the hired individual rendered too much added sensory stimuli, and the patients would, quote, have to rest for days after such scheduled appointments. Patients described how inaccessible and scarce typical health-related navigation and healthcare system supports were there. They were left to navigate on their own independently. ME patients shared how they were left to search for information, to research symptoms, to find treatments, and to bring information to their family doctors, and to find other doctors, and to find other patients to learn from. Patients repeatedly noted that there was not a clear path of treatment and that treatment was associated with unclear expectations. This was a hard road for patients as self-navigation was physically and mentally demanding, which furthered their exhaustion and lowered their health. In the corner of the graphic, there's a suggestion of a hub, and this came from the patients. Many suggested of having one single place to seek care, as well as those other aspects of their support needs, like community, home care, financial, and legal support would be very welcomed. So again, here are some quotes that we collected, and each of these are three different ones from it's one quote from a patient living at home. Bed making may take me 3 days. 1 day to strip the sheets, a second day for laundry, so I sleep on a bare mattress, and the third day to put it back together. A second patient said, if I have to cook my own food, I'm often too tired to eat. Our next is a third theme coming up. And this slide is to capture diagnosis. Here you can see that diagnosis over on the left-hand side is a big challenge. And then alternatively, the knowledge in the extended healthcare system is also lacking. For ME patients, the challenge in receiving care in a timely and informed and supportive manner was identified in all the interviews in all the focus groups. Participants shared they had lengthy journeys to be diagnosed that included multiple testing, GP and specialist visits, and they also needed to rely on their own self-advocacy, if not tenacity. All the participants recalled experiences of types of dismissal, lack of knowledge by their main provider, and/or a lack of clinical care. Over in the right corner, you'll see the letters CCDP. That's for the Complex Chronic Diseases Program located at BC Women's. At the time that the data was collected, during this project, the CCDP is currently the only provincial funded program for ME in BC. The waitlist is about 2.5 years to be seen, and patients are enrolled for a year. They receive a physician consultation and select from a series of self-management group education models. So while the CCDP is seen to be a benefit for some, the preceding 2 years, patients often become sicker from trying to push themselves to manage their life and the journey of their diagnosis, and they're left to create their own treatment path in that meantime as well. Then, once admitted and enrolled, they are discharged and left back to navigating themselves. Here's from another patient. If your doctor doesn't believe you, you spend so much time, energy, and frustration trying to find the help. So our fourth and final patient theme is about dismissal and stigma. This was a significant and persistent theme. Patients shared many stories on reflecting on their interface with the healthcare system. Feelings of dismissal by the system was consistent throughout our patient contact. Due to the negative experiences with the healthcare system, patients spoke about concerns, if not fear, in accessing their healthcare, not only for their ME, but for any other concerns. Patients shared examples of how they would not disclose their illness for fear of stigma, and they described how they were constantly weighing out the consequences of seeking help. A surprising number of patients described how much and how often they avoided exposure to the healthcare system. As you see on this slide, the hardship and struggle for self-advocating is a huge challenge for ME patients. Patients have to continually self-advocate to ensure their symptoms are taken seriously, and several talked about the common diversion towards psychiatric care. It's interesting to hear that from a few patients, neurology consults were seen to be particularly dismissive. Patients were also looking to be taken seriously and for ME to be routinely acknowledged by and responded to at the healthcare system. Patients want this disease that they have to exist when they enter the healthcare system. Here's a few more quotes. My GP is not on board. It's like, I don't even know if he believes in this disease. Most of the time when you say ME or chronic fatigue to a doctor, they make a disparaging comment, or they look at you blankly, or they ask you kind of slightly confrontationally, well, what is that? What does that even mean? Or they call neuropsych or a psychiatrist to come in and give you an evaluation. When I enter an access point of the medical system, I would like to be met with, oh, you have myalgic encephalomyelitis. That's a multi-system disease. That can be quite serious. So I'm going to switch over now to the clinician material that we collected. So we conducted a short 10-question electronic survey. This survey was designed to look at the clinician's level of knowledge and confidence and their experience in treating ME patients. We also provided a couple open-ended questions to collect some suggestions and comments from the respondents. As I mentioned earlier, the responses that we received drew from clinicians across all the health regions of BC, and the pie chart on the side shows the breakdown by profession. So the light blue and the peach color is physicians, and that's about 46%. So that's just under half. And then a quarter were from the nursing professions. And then we had some allied health and some admin also. So we asked clinicians to self-rate their knowledge on ME using a scale of 1 to 5. The bars on the left, number 1 and number 2, that would mean that they indicated that they had no knowledge or some knowledge, and that represented about half of the respondents. Another question we asked is on their experience of contact with people with ME in their practice. About half said that they had interacted with an ME patient, and about 20% said that they were unsure if they had or not. The next question we had was about their confidence. So the narrow orange line that doesn't have a percentage on there indicates a response of those who felt very confident to diagnose. And that number is actually 3.5%. Again, the blue and the red is over, or sorry, the blue and the green, my mistake, the blue, my apologies, is about 44%, and they're not confident. So again, we've got sort of just around that half of the population that responded. So here is another question about confidence, and it's about their confidence to manage or care for a person living with ME. So again, we've got not confident as slightly higher and just above the 50% mark. What we haven't presented here is the details of the open-ended questions. But there were so many responses collected there that we actually treated it a little bit like qualitative data. And we collected that there was quite a consistency in people offering that they were looking for recommendations for clinical care, that they were looking for improved practitioner education, looking for improved diagnostics and clinical guidelines, and they were looking for increased access to referral resources. Here's a quote that we took from some of those open-ended responses. Would like to see guaranteed biomedical education about ME and health profession education curricula, including physician, nursing, pharmacy, PT, OT, as well as regular education supported by the registered colleges for all professions and specialties. Another quote, there remains a strong psychological bias, especially from neurologists, and clinicians don't know how to treat or diagnose or treat patients with ME CFS. I've got one more quote page here. We need resources to help patients and providers recognize that this is not psychosomatic, that there is more to treatment than CBT and coaching. Patients need our humility, that we do not have the answers, but that does not mean that they are faking it or that we disbelieve them. So overall, from the clinician part of our project, we collected these 4 themes. That increased awareness that there's a need for increased awareness in the ME community, of ME in the clinical community. There's a need for improved clinical resources. There's a need for improved community referral resources. And there's a need for improved empathy for the patient experience and/or the patient's lack of options. So then what we did was we pulled together our overall findings. So we're taking everything that we learned from the patient contact and everything that we learned from the clinician contact, and we came up with our community projects overall final statements. So I'll direct you to the top. The first and foremost one that we concluded is that a patient's experiences of living with ME is dire, alarming, and urgent. To the left, patients are concerned with the medical system's poor awareness of ME. At the bottom left, both patients and clinicians expressed a desire for improved education for ME care. Moving over to the right side, that both patients and clinicians acknowledge that there is a paucity or that there isn't enough available clinical care resources. And then on the far right in the corner, it's just a reminder that this content that we're sharing today is available in a full text report and a shorter text report, and the graphics and various things are also available on our website. I think what I would also offer is that from our research team's perspective, this was a small project, but it was a mighty project, and that we were successful despite COVID. There is limitations of this project. Its size means that we can't make it completely generalizable to the entire province, but it offers some possibilities of future inquiry, and that we were beginning to collect patients' experiences to be shared more widely. We gratefully acknowledge that the participants who did participate with us were willing to share their experiences of living with ME, and they're not easy stories to hear. But we do believe that there's aspects that we can make some improvements on, and we're looking forward to that in the future. So with that, I'm going to close our time for now. I'd like to thank you for joining us today and to listening in on our project. Our website is listed on the slide above here, and there's also a contact email address if there's any specific questions about this work. And with that, I will pass the mic back to Hillary, and she will guide us through a question and answer period.
Thank you, Lana. I'm just going to stop the recording now. As noted at the beginning, we're not going to be recording the question and answer session. So